There's a simple drink that's been shown to reduce the risk of heart attack and stroke by over 50%. That drink is garlic water. It's surprising that garlic isn't widely recognized as a mainstream treatment for heart health. Then again, maybe it's not so surprising because it doesn't generate profits for the pharmaceutical industry. Today, I'm going to share with you a natural, simple, and affordable solution: garlic water. Of course, the information I provide is not a substitute for medical advice. Always consult your doctor before making any changes to your routine. While many studies have confirmed garlic's ability to significantly lower blood pressure, that's just the tip of the iceberg. Garlic offers a wide range of powerful cardiovascular benefits that you may not be aware of. First, garlic has antiviral properties. Since most common colds are caused by viruses, you should consider eating garlic at the first sign of symptoms. This is important because every time your body fights an infection, it increases inflammation throughout your body, a known risk factor for cardiovascular disease. Second, garlic has antifungal capabilities. For example, if you have a candida infection, which often shows up as a white coating on your tongue, garlic is a natural solution. This condition is common after taking antibiotics because they wipe out the friendly bacteria that help keep fungus in check. When that control is gone, fungus can overgrow. Like a viral infection, this fungal overgrowth contributes to chronic inflammation, which is bad for your blood vessels. Garlic is also a potent antibacterial agent. It acts as a natural antibiotic, effective against both tuberculosis, TB, and H. pylori, the bacteria that not only cause stomach ulcers, but are also linked to inflammation of the arteries. Garlic is also an effective antiparasitic, helping to eliminate worms and other parasites. The overall goal of all of this is to reduce the burden on your immune system, which in turn lowers inflammation throughout your body. And here is the most crucial point: garlic's power to address the root of many problems by improving insulin resistance. Chronically high insulin not only causes issues like a fatty liver, but it also creates inflammation and hardening of your artery walls, setting the stage for blood clots to form, the direct cause of a stroke. By helping to lower insulin and improve insulin resistance, garlic helps control blood sugar and protect your blood vessels. If you've been watching my videos for a while, you know all the consequences of excess insulin. There have been numerous studies, including cancer research in Europe, that have demonstrated garlic's strong anti-cancer effects. Not only that, but garlic can also help treat arthritis and any condition ending in itis, as this is a medical term for inflammation, and garlic is a powerful anti-inflammatory. So it's useful for anything like bursitis, tendinitis, or arthritis. Garlic may also help increase endurance if you're an athlete. But today, I want to focus primarily on heart health. Over 40 clinical trials have shown significant benefits of using garlic for the cardiovascular system. In fact, one of them, which I'll link below, revealed that the relative risk of heart attacks and strokes could be reduced by more than 50%. With such a tremendous benefit, the question is, why isn't everyone adding garlic to their diet regularly? To understand this better, let's look at how it works. There's a compound in the body called thromboxane. I won't get too deep into the chemistry, but essentially, its job is to make platelets in your blood stick together, forming a clot. This clot can then get lodged in the blood vessels of your heart, causing a heart attack. Or it can travel up to the arteries in your brain, potentially causing a stroke. This compound also causes vasoconstriction, meaning it makes your arteries clamp down, especially the coronary arteries. And now, I'll explain this topic a bit further so you can understand what I'm talking about. First, let's discuss the more menacing of the two, unstable angina. This condition is a true medical emergency. It's often associated with what's called a vasospastic event, where the coronary arteries that feed your heart muscle suddenly spasm and clamp down, severely restricting blood flow. The real peril, however, lies in the nature of the plaque buildup within the artery. In unstable angina, this plaque is soft, inflamed, and vulnerable, like a ticking time bomb. It has a high risk of rupturing spontaneously, without any clear trigger. When this unstable plaque breaks open, it can form a clot that travels through the bloodstream, ultimately lodging in a smaller vessel in the heart, causing a heart attack, or in the brain, causing a stroke. This is why it is so profoundly dangerous. A defining characteristic of unstable angina is its unpredictability. The pain can strike out of the blue, even when you are completely at rest, perhaps while reading a book or even waking you from sleep in the middle of the night. The discomfort might last for 10 minutes, subside, and then return. Any new, changing, or unexpected chest pain that occurs at rest should be treated as an urgent medical situation. In contrast, stable angina operates on a more predictable pattern. While it also involves plaque in the arteries, this plaque is typically older, harder, and protected by a thick, fibrous cap, almost like a callus. This makes it far less likely to rupture unexpectedly. Instead, the pain of stable angina is consistently triggered by physical exertion or emotional stress, sometimes when the heart demands more oxygen-rich blood than the narrowed artery can deliver. You might feel it when you walk up a flight of stairs, carry heavy groceries, or work in the yard. Crucially, the pain typically subsides within a few minutes of stopping the activity and resting. While it's still a serious warning sign of underlying heart disease, it doesn't carry the same immediate, unpredictable threat of rupture as its unstable counterpart. Now, there are many risk factors for angina. Of course, we have smoking and nicotine use. Obesity is also a factor. Then there's diabetes, a condition where you have issues with insulin and your arteries become very, very stiff. High blood pressure is another risk factor. Stress can be a trigger. Insulin resistance will cause inflammation inside the arteries. When that happens, you see a domino effect. The body tries to heal it by creating a band-aid out of cholesterol, calcium, and protein, which forms the plaque. Alcohol is a cause. Marijuana and cocaine can also be triggers. And energy drinks. Some teenagers today drink a lot of energy drinks, combining large amounts of sugar with caffeine, and there have been quite a few cases of heart attacks in young people due to these beverages. All right, now let's get back to that compound, thromboxane, which is a very powerful vasoconstrictor. When levels of this compound in your body are too high, you get high blood pressure. This chemical usually shows up after an injury or when there's inflammation. As it turns out, some things can inhibit this compound. This is the principle behind how blood thinners work. Even aspirin works by inhibiting this compound. But did you know? Garlic contains several compounds that act as a natural inhibitor for thromboxane, but without the side effects. Olive oil has this ability as well. Garlic has natural properties that help lower blood pressure, reduce the stiffness of your arteries, likely because it helps lower insulin, and it can help bring down your calcium score. There's an excellent test, perhaps one of the most accurate predictors of heart attacks, called the calcium score test. Ideally, that score should be 0. If it's over 400 or 500 or even over 1,000, it can strongly predict your risk of a heart attack. So it's a very good test to get. But guess what? Garlic can help lower that calcium score. In studies where statin drugs were used to try and lower this score, they were unsuccessful, but garlic can help bring it down. Garlic can also help balance your lipid and cholesterol levels by helping your body produce more bile. Bile is the very tool your body uses to get rid of excess cholesterol. So by increasing bile flow, garlic gives your body a more effective cholesterol cleanup mechanism. Now, remember that garlic is highly antibacterial. It works on viruses, fungi, and bacteria. Because of this, it can help with another serious heart-related issue, bacterial endocarditis. This is essentially an infection, sometimes caused by staph bacteria or fungus, that forms biofilms right inside your arteries. And you know what? Garlic can act as a natural antibiotic to fight this condition without the side effects. So that's just one more benefit garlic can offer your cardiovascular system. So let's recap the main points. Garlic helps thin the blood, so you're less likely to form dangerous clots. It's antibacterial, helping to fight infections that can affect the heart. It helps move excess cholesterol and other lipids out of the arteries by increasing bile production. It can help regulate blood pressure and fight against the constriction of blood vessels. It can help soften the arteries and remove any excess calcium. So I don't know about you, but I really don't see why someone wouldn't use garlic regularly for its immense cardiovascular benefits alone. All right, so how do you make this incredibly complicated garlic water? Yes, I'm being sarcastic. Garlic water recipe. Crush 1 clove of garlic. Put it in a glass of water, about 8 to 12 ounces. Add 1 teaspoon of extra virgin olive oil. Let it sit for about 15 minutes. This step is very important because we want all the phytonutrients to be released from the garlic after you crush it. We add the olive oil not just to help reduce that thromboxane compound we talked about, but also to help your body absorb these phytonutrients since they are fat-soluble. Now, you don't have to make garlic water. You can add garlic to your food. You can also take it in supplement form. There are probably 100 different ways to get your garlic in. Just make sure your garlic doesn't come from China, as they sometimes grow it there using chlorine-based chemicals and use sewage as fertilizer. So try to buy your garlic locally, or even better, grow it yourself. Don't forget to check out our other videos on early warning signs of stroke and effective prevention strategies. This knowledge could help you or someone you love avoid a serious and preventable health emergency.